Imagine this, you're feeling fine, you're taking medication as prescribed, and then, out of nowhere, a blood clot forms. It blocks a vein, maybe even an artery, and suddenly, everything changes. A simple clot could mean a heart attack, a stroke, or a life-threatening blockage. Now, you might be wondering, why would my doctor prescribe a medication like warfarin that can cause more bleeding if it's supposed to help prevent clots? In this video, we're going to break down exactly why your doctor prescribes warfarin, how it works, and what you need to know about taking it safely. By the end, you'll have a clear understanding of why warfarin might be in your life and how to manage it with confidence. What is warfarin? Warfarin is an anticoagulant, commonly known as a blood thinner, but it doesn't actually thin your blood. Instead, it helps slow down the body's ability to form clots. If you've heard of Coumadin or Gentoven, these are brand names for the same drug. Warfarin is often prescribed for people at risk of developing blood clots, and although it can help prevent major health problems, it's important to understand both the benefits and risks. Why doctors prescribe warfarin? Blood clots aren't always the body's friend. While clots are essential for stopping bleeding, too much clotting can be dangerous. This is why doctors prescribe warfarin. Here are some common reasons why you might be prescribed this medication. 1. Pulmonary embolism. When a blood clot forms in the lungs, it's a medical emergency. Warfarin can reduce the chance of this happening. 2. Heart attack. A clot blocking blood flow to the heart is a heart attack. Warfarin helps prevent this from happening. 3. Deep vein thrombosis, DVT. This is when clots form in deep veins, often in the legs, which can cause painful swelling and other complications. 4. Atrial fibrillation and heart valve replacement. These conditions increase the risk of clots, and doctors often prescribe warfarin to help manage this risk. 5. Clotting disorders. Some people are simply more likely to form clots because of conditions like thrombophilia. By taking warfarin, you're decreasing the risk of these potentially fatal complications. How does warfarin work? Here's how warfarin acts in the body. It blocks the production of certain clotting factors. These clotting factors rely on vitamin K to function, and without them, your blood is less likely to form clots. Think of vitamin K as the key ingredient your body uses to make these clotting factors. Warfarin doesn't let vitamin K do its job as easily, so clots are less likely to form. If you do get hurt, you'll still clot and stop bleeding. However, it'll take a bit longer than it normally would. This reduced clotting ability is why warfarin can protect you against dangerous blood clots. Taking warfarin safely now. Taking warfarin is not as simple as popping a daily pill. Because it can increase the risk of bleeding, warfarin requires careful monitoring. Here's what you should know. Daily routine. Take warfarin at the same time each day, and don't miss a dose. If you do, don't double up, just get back on track with the next dose. Regular blood tests. You'll need regular blood tests to monitor how fast or slow your blood is clotting. The results help your doctor adjust your dosage as needed. Follow instructions, always stick to your prescribed dose and never make changes without consulting your doctor. Even if you're feeling fine, it's crucial to continue taking it. Risks and side effects of warfarin. While warfarin can save your life, it comes with a serious risk: increased bleeding. The FDA has even given warfarin a boxed warning because of this. Here's what you might experience. 1. Easy bruising and bleeding. You might notice that you bruise or bleed more easily, especially during the first month. 2. Internal bleeding. More severe side effects can include internal bleeding, which is why regular checkups are essential. 3. Allergic reactions. If you ever have hives, swelling, or trouble breathing after taking warfarin, seek immediate medical help. This could be an allergic reaction. Important do's and don'ts. Warfarin doesn't just interact with your body, it can interact with other medications, supplements, and even certain foods. Here's a checklist to keep yourself safe. Medication interactions. Some common drugs, like aspirin or ibuprofen, can increase the risk of bleeding when combined with warfarin. Always talk to your doctor before taking any new medication. Food and supplements. Foods high in vitamin K, like green leafy vegetables, can counteract warfarin's effects. Let your doctor know about any dietary changes or supplements. Doctor notifications: if you're scheduled for surgery, dental work, or anything that could involve bleeding, make sure the healthcare team knows you're taking warfarin. Avoiding injury: use an electric razor, avoid toothpicks, and be cautious with sharp objects. Even minor cuts can bleed more when you're on warfarin. It's also worth considering wearing a medical alert bracelet or necklace. If you're ever in an accident, emergency responders will know that you're taking warfarin, which could help them manage your care better. When to seek medical help: if you experience any of these symptoms while taking warfarin, call for emergency help right away. Unusual bleeding: this includes nosebleeds, bleeding gums, or blood in your urine or stool. Severe headaches or dizziness: these could indicate bleeding in the brain. Difficulty breathing: this could be a sign of an allergic reaction or a more serious issue. Warfarin alternatives: some people may wonder if there are alternatives to warfarin. There are other anticoagulants on the market, but each has its own pros and cons. You and your doctor can discuss options that might work best for your health needs. Final thoughts: managing your health with warfarin. Warfarin can be a critical part of your health journey if you're at risk of blood clots. While it's not without risks, with proper monitoring and attention to your doctor's guidance, you can manage these risks and live a healthy life. It's about finding the right balance, staying informed, and always communicating openly with your healthcare team. So, if warfarin is part of your daily routine, remember, you're not alone, and with the right information and support, you've got this under control. Stay informed, be proactive, and reach out to your doctor whenever you have concerns. Warfarin may be a small pill, but it's a powerful tool for protecting against life-threatening blood clots. By following these guidelines, you can manage your health and live confidently, knowing you're taking an active role in your well-being. Thanks for watching, and stay safe.